guest in this segment, Seth DiStefano, Policy Outreach Director for the Center for Budget and Policy. Good morning, Seth. How are you, sir?
Doing well, Rob. How are you all doing today?
We are well. It's air-conditioned here, not in John's office, but here in this studio. How about yourself? Are you comfortable?
For now, give it about an hour and a half, and things will get pretty miserable here in Charleston till about 8:30 or 9 o'clock tonight. So.
Yeah. What's on your calendar for today? Is the interim session still meeting today, Seth? Do you know?
Yeah, so interims for the month of June were remote field trip interims, if you will. Maybe that's being a little harsh on the legislature, but a couple of times a year they'll do interims outside of Charleston.
Mm-hmm.
And this month, for the month of June, they went to Stonewall Resort.
Right.
And there's only maybe a handful of committees that met publicly. I think Joint Finance and Government Organization, Finance and Judiciary, and I believe Health Committee meets today as well. Outside of that, they did some tours of the local area, and they've done this before. They've been to Capon. They've been to a few other places. I think the idea is to give the legislature a perspective that exists outside of the Charleston bubble, if you will.
Yeah, usually when they had it at Capon, they all said it was a pretty good experience. Some of the folks who aren't used to the growth that the Eastern Panhandle has had an opportunity to find out what it's like to be on I-81 or Route 9 at the wrong time of the day. Yeah. Mm-hmm. And they came back with a little bit of a better understanding, and they can also see what things cost here versus other parts of the state. Right. Seth, we've done no shortage of interviews on Medicaid and SNAP benefits and proposed changes to that. What's the latest as you understand it?
So let's talk process. This is, of course, relating to the budget reconciliation bill. Budget reconciliation is a process that both, presidential administrations and Congresses of both parties have utilized over the decades to push through priorities that have direct impacts on the federal budget, either by adding revenue or by taking it away. Okay. The rules between the two chambers, the House of Representatives and the United States Senate, are a tad different between the two of them. The House of Representatives really does not have a vetting process for the items that they push through on budget reconciliation. Everything's just a straight up or down vote. In the Senate, however, and this is kind of where I think the listeners should be paying attention this week especially, the Senate does have a pretty strict set of rules as to what is allowed to pass by a simple majority vote via budget reconciliation and what has to have 60 votes to get past the basic filibuster, if you will. And so this week, starting very, very early Saturday morning, the Senate parliamentarian is issuing rulings based on the draft language put forward by the various Senate committees as Majority Leader John Thune and the majority Republicans in the Senate put together what they would like to see in a budget reconciliation. Some things, as proposed, will continue to potentially be tweaked, be modified, be removed, or put to the floor. Some things the Senate parliamentarian has ruled, in their current form at least, cannot go through a simple majority vote. They have to get 60 votes. And there was some pretty big news out of the Agriculture Committee. We are waiting to hear on the rulings from the Finance Committee language today.
They're hoping to get everything passed by July 4. I'm not sure how much work they were getting done during the last couple of days with the Iran-Israel situation and the United States involvement there. I don't know if that set them back or not, but is July 4 still the target date?
I believe the president has stated his druthers, if you will, for a July 4th kind of I want the bill on my desk for, the good old-fashioned signing ceremony. I do think your instinct is a little correct. That recent international events have a lot of folks a little more preoccupied. The rulings from the parliamentarian were supposed to happen last week and have admittedly been a bit delayed. So, and once the delays happen, that can create more delays, right? So if you didn't, for instance, on the Supplemental Nutrition Assistance Program, the cost shift to the states that had been proposed both in the House and the Senate, the parliamentarian said, no, you can't do that with 51 votes. If you want to do that, you have to get 60 votes, right? And so with that information and that ruling, folks within kind of the Senate Agriculture universe, there's a handful of folks that have said, well, we want a second bite at the apple. So we want to try and rework that language to find a way to, send it back to the parliamentarian. And that takes more time, right? But then once that happens, Rob, the opposition has the opportunity to contest it again, right? They can come back and say, no, wait a minute. this here was already ruled as out of order, and these things can drag on a little bit. So, I am loath to make predictions. I know that, some folks, are trying to create the air of inevitability, if you will, but there do seem to be a few bumps in the road.
Once this bill passes, and I'm going to assume that it will pass, what will West Virginia's legislature need to do, if anything, once these changes take place?
Well, I mean, if the bill were to pass in the current form as I kind of understand it now, the state legislature is going to have to confront some pretty difficult realities as far as the impact that job losses will have through specifically the Medicaid cuts, right? So if the bill passes as folks want it to pass, and you see, a massive reduction in Medicaid spending, especially through the federal match that West Virginia enjoys with the Medicaid program. We have one of the highest federal matches in the entire country. That federal match isn't just responsible for providing health care for 1 in 3 of our friends and neighbors across the state. It's responsible for thousands of healthcare jobs. We're talking doctors, nurses, x-ray technicians, the people that take your blood pressure when you go get a checkup. So many of those jobs across West Virginia, Panhandle, Southern Coalfields, Northern Panhandle, Ohio Valley, you name it. So many of those jobs are directly related to the matching funds that we receive now, right? So if we start seeing massive reductions, and that's what's on the table, massive cuts to those matching funds, the first problem that the state legislature is going to have to contend with is much lower collections in revenue for the state, right? So if you have, thousands of job losses in the healthcare sector, which I would point out is one of the most positive job growth sectors in West Virginia over the last 10 to 12 years. You're going to see less people paying personal income tax. You're going to see less people, going out to dinner and taking in a movie on the weekend, and so therefore less sales tax, less people buying stuff. So, that to me is probably going to be one of the biggest and quickest problems when you compare that to increased, obligations for PEIA, other things the legislature has kind of new spending they have phased in. You can end up with a state budget crisis very quickly on your hands.
Jonathan.
The people that get knocked off Medicaid, they cut Medicaid, people get knocked off, they're going to go on ACA plans, which actually pay the hospitals, doctors, providers, pay them a higher percentage than Medicaid does. So how are we going to have job losses with people leaving Medicaid? And the ACA plans, I mean, they're eliminating the zero premium plans. They're saying, I think it's going to end up probably the minimum premium payment about $20 a month. How are we going to have all these job losses when they're actually going to get more money for providing the same services?
So that's a great question, John. I appreciate you asking. I think kind of the crux of the issue within the marketplace comes down to what is oftentimes referred to as the premium tax credit. Premium tax credits are kind of outside of the expansion population, right? So there was the Medicaid expansion population through the Affordable Care Act that provided Medicaid coverage up to 138% of the poverty line. Right. And then there's the premium tax credits are basically what make premiums affordable for just about anybody who buys from the marketplace.
Correct.
Right? So for a lot of folks, those particular tax credits are the difference between a premium that is, maybe, I don't know, for argument's sake, let's say $500 a month, and a premium that is $1,700 a month or more, right?
Right.
And so that relies on tax credits that are wrapped up into the Affordable Care Act. Within the House and Senate plans, those tax credits are allowed to expire. They aren't allowed to be around anymore in order to push the quote unquote savings towards tax cuts that are heavily slighted toward the wealthy.
No, it's the extra tax credits are what they're getting rid of. They're not getting rid of the basic tax credits. I run a very large Medicare and health insurance agency. Yeah. We're following this very, very carefully. I mean, what it's going to do is it's going to put people into ACA. They're going to have some copays and stuff like that, people coming off Medicaid, and they'll be eligible. By loss of Medicaid, they'll be eligible for the tax credits. That's how it works. I mean, maybe the copays won't get paid, but even with what the insurance companies pay, the doctors' hospitals will be more whole without the people's copays than they are from Medicaid. I don't see the downside.
If you can be eligible all you want. We can make people eligible all they want, but if the only thing they're eligible for is a multi-$1,000 a month copay, it doesn't really matter.
They won't have a multi-$1,000 a month copay. We do these all day long for low-income people.
I'm currently eligible to buy a Rolls Royce. That doesn't mean I can do it.
No, these people will have these.
Well,
people,
you guys got to go one at a time here. So
at their income level, coming off Medicaid, they'll qualify for the tax credits. Their plans will be really, really, really inexpensive.
Give me an example, John, of how much their premiums would be a month.
Somebody with super low income, they're paying right now. A lot of them are paying zero for ACA plans. They're going to pay $20-$40 a month. They've already gone through all this stuff.
All right, Seth,
they're going to pay nothing.
You don't agree with that, Seth?
I do not agree with that. No, what I'm seeing is that you're having people, expiring the tax credits that make their health insurance affordable, and then coming back and saying, well, you can still pay a premium. It's just going to have to be, $25,000 a year. Basically pricing them out of the market of their insurance.
I'm 56 years old. My premium, which is $1,200 a month for me, which is $14,400 a year, without tax credit, okay? Nobody's paying $20-something thousand a year. That's preposterous for one person. I write health insurance plans all day long, my agency does. We write for low-income people. We write for middle-income people. They're not paying that. They're paying, $20, $25, $50. We wrote a family yesterday, $75,000 they make, family of three. Their premium is $400 a month total for the three of them. And if somebody's coming off Medicaid, they're going to be much lower than that. ACA will take care of them. They will have copays. They'll have a maximum out of pocket. They'll have all the things that regular people with regular insurance have. But it's not this death knell. I stand with you guys on SNAP. I think SNAP shouldn't be cut. I think people need food. There are a lot of people who are food insecure. But ACA will take care of them. They won't have high premiums. That's just, that's it. Incendiary.
Let Seth respond again. Go ahead, Seth.
Yeah, I appreciate your comments about the Supplemental Nutrition Assistance Program. I really do. And I was heartened to hear, at least temporarily.
Seth, your phone's getting garbled a little bit. Did you move to a different location?
No, I'm here. Can you hear me?
Yeah, go ahead.
Sorry. I appreciate your comments about SNAP. I really do, John. I would have to stand in disagreement that the marketplace is going to be there to take care of people. What Congress is doing is a bit of a sleight of hand, if you will. It's saying, yes, you'll still be able to buy from the marketplace, but the tax credit that actually makes that transaction possible for you. If you're, a middle income or a low, maybe if you're at 139% of the poverty level, but you're also not making enough, or you don't have a job that has good provider benefits, that if that tax credit is allowed to expire, then the coverage is going to be, you're basically just going to be priced out of the market. And that's just what I would say about that. And, this impacts more than folks kind of in that transitionary period, right? As if you're coming off of Medicaid, this also really impacts a lot of small business owners and people who are self-employed as well, where I think, additionally, the ripple effect could genuinely harm West Virginia's already fragile kind of economic standing right now.
We have tons of those people on ACA plans who are getting tax credits. I disagree. We've been following NABIP. We've been following all sorts of the health insurance marketplace stuff, and there's nothing that's saying that. What they're saying is they're not going to have the zero premium plans. They're going to make sure people are paying a premium, but it's going to be based on your income still, and the low-income people are still going to pay almost nothing for their health insurance. There's no reason to be alarmed. All it's going to do is take the money out of Medicaid and make them actually have copays, which might get some people back to work, but they're going to have copays. They're going to have coinsurance.
Maybe between Seth and Jonathan, you guys know the answer to this. Stacy Burkett asks, doesn't the Big Beautiful Bill also include cuts to ACA?
It does. It may includes changes to ACA, but they're still going to have the tax credits. They're just not going to be taking plans down to zero. People are going to have to pay some money.
Guys, the Hospital Association over the weekend has officially come out and said this bill is going to be very, very harmful for the amount of money it takes out of Medicaid. 7 hospitals throughout West Virginia have been listed publicly as highly likely to close with the loss of federal dollars by closing off the ACA, cutting Medicaid, expiring the premium tax credit. This is a bad deal for West Virginia. I don't know how else I can come out and say it. It's not just me saying it at this point, right? I know I've been on the show multiple times. I've been, beating the drum and doing my best to inform the listeners as to the process and to the content of the bill. But at this point, I think we should all take note that it's not just Seth from the West Virginia Center on Budget and Policy kind of raising the alarm that there are serious consequences for West Virginia. When you have an organization like the Hospital Association coming out and saying, we are really worried. We don't know what's going to happen when people immediately start going to emergency rooms for uncompensated care. When you have, I was doing an event in Pocahontas County not 3 weeks ago where I had the director of an EMS service saying if we have to pick up any more uncompensated ambulance rides, because Medicaid is one of the largest reimbursement sources for ambulance service, that person told me, I don't know what we're going to do. We're already on a shoestring budget, and emergency squads around the state can't afford to keep doing this, right? So, it's not just me saying this. There seems to be a lot of consensus as to the concerns specifically around cuts to Medicaid and these federal matching funds.
John, hold on a second. Wouldn't some of the ACA plans by election allow you to get ambulance coverage for these situations?
I mean, not if you can't afford the premium in the first place. And that's really where Congress, that's just one piece of the bill, of the reconciliation bill and the language.
Well, Seth, let me ask Jonathan, you write these policies. Do some of the lower income plans include ambulance coverage?
They all include ambulance coverage. All of the ACA plans. There are so many requirements the ACA plans have to have. Seth, let me ask you, how many people do you think, if the bill goes through as it stands, how many people in West Virginia are going to lose Medicaid? I think what the hospitals are worried about is those people aren't going to get around to applying and getting into an ACA plan, and then they're just going to be showing up, and the hospital's just going to have to take care of them.
It's a valid question.
Well, it depends on, when you think about the different mechanisms that are being, the different levels of red tape that are being thrown at folks, this goes beyond just cuts, right? So moving beyond our disagreement over tax credits, I'd like to take a few minutes to talk about things like, onerous work requirements and having to recertify your Medicaid eligibility more than once a year. So right now, if you're receiving Medicaid once a year, you have to go to the department and recertify your eligibility to be on the program, right? Congress wants to up that to at least twice a year, right? Just by virtue of doing that, people who are qualified for Medicaid coverage are going to get kicked off by the thousands. Work reporting requirements, forcing people to show up and validate whether or not they have held on to a job for a certain amount of time each week over the course of several months. We estimate right off the top, you're going to see about 40,000 people who are qualified kicked off of the Medicaid program. That could grow to over 100,000 over the course of 10 years. You're talking hundreds of millions of dollars in federal matching funds down the drain just based on that. So it's not just the outright cuts. In many cases, it's the additional levels of bureaucracy that Congress wants to push on the working poor and folks who, may not be working, but maybe they receive Medicaid coverage because they're taking care of a family member at home, or maybe they're going to school. And don't really have a job just quite yet, but they still need to be able to get to the doctor. That's kind of one of the key markers of this giant, big, beautiful bill is all of the very not so pretty paperwork that seems to be almost exclusively targeted to middle income and lower income families across West Virginia and the nation.
Well, those are the people that are getting free health care. I mean, they should have to prove that they deserve it. Let me ask you just one quick question, just personally. Do you feel that people who are capable of working and choose not to should be receiving free health care from our tax dollars, or do you think those people should have to work? I'm not talking about, extenuating circumstances. I'm talking about people who are healthy enough to work and choose not to. Do you believe they should have free health care?
I believe that right now, within the next 2 months, over 400 coal mining jobs are going to evaporate in Wyoming, Logan, and Boone County. I am not going to go down there and tell those people that they have to prove to me that they're working 20 hours a week or even trying to apply for 20 hours of work that does not exist in their community so they can go to the doctor when they need to. I am not going to go up to Weirton, where that community has been officially crushed, with Cleveland Cliffs, providing a very unceremonious goodbye, and tell them that they have to prove to me that they're worthy of an exemption and have to sit at an office all day long going through God knows how much red tape in order to be able to go to the doctor when they need to. Right? People, it's not just the right humane thing to do to make sure that people have health care. It's good for business. People can't work when they're sick. People can't work when they can't get healthy. And everything Congress seems to be doing at this point is pushing middle income and lower income folks further and further into the hole with this reconciliation bill. I really hope Senators Justice and Capito have the courage to step up and get things back to the drawing board for their constituents.
Well, and you don't have to go to DHHR to recertify for Medicaid. They send you a form. It's 2 pages long. You fill it out, you sign it, you mail it back. It takes no time at all. And if they've got to do that twice a year, it's an extra stamp. That's about it. I agree with you. I think people who are recently laid off or stuff like that while you're on unemployment, you get a period of time where you get your coverage. I'm talking about the habitually unemployed people who just don't care, who are just taking from the system, who are taking from you, your pay, your taxes, my taxes.
On that note, Jonathan, thank you. I got 30 seconds. Seth, final word.
I think that, all this talk of like the habitually unemployed is a myth. This is something that has been proven within the Medicaid program itself. The vast majority of people in Medicaid who are able to work are happy to do it, are out there doing it. They're just not making much money. So why should they have all this extra red tape? And the people who potentially aren't working for money are doing things like looking after a loved one and not
Seth,
getting for it.
I'm out of time. I thank you for yours. We have to get to our break. We are back with more right after these.